So this video is about headaches, but a specific type of headache. So many of us are getting these suboccipital or back of the head headaches. So right at the base of your head, right between the head and the neck, you end up just getting a real achy kind of nasty headache. And a lot of times we think that that headache is really coming from that area. So maybe we'll go to a massage therapist and they'll really start playing around with that area and poking around in that tissue. And, you know, you're taking Theracanes and your fingers and poking around in that tissue, and it's not really working. And the reason it's not really working is because a lot of these headaches, particularly in this day and age, are coming from the front of the neck. They're coming from the front of the neck because of all of these electronics that we use. We're busy playing games on our phone, which means that our chin is down towards our chest, playing with our iPads or our laptops, again with the chin down toward the chest. I meet older people who maybe they sit and they read, chin down toward the chest. Right? Even when we sit, say, in a recliner to watch TV, we kick the thing back and our head ends up in this position so the chin is down toward the chest. So we're putting a lot of pressure on these muscles, creating a lot of tension in these anterior neck muscles, these front neck muscles. This is creating an overstretching of the muscles in the back. So even though your pain is back here in the back of the head, as you work that area, you're just not going to get relief. So I'm going to lead you through a series of moves that you can do to yourself that will help relieve these muscles in the front of the neck. This is my son-in-law, Nick, and he's going to help us do it. So I'm going to guide him so you can see that he can do it himself, you can do it yourself, okay? First thing I want you to do is put your fingers on either side of the thyroid cartilage and just kind of move it back and forth. What you're checking for is tension. Is there more tension on one side than the other? Does the cartilage move easier to one side or the other? What would you say, Nick?
It definitely moves easier going to the left.
Moves easier to the left, okay? If it moves easier to the left, that means his tension is on the left, okay? So what we're going to do with these moves is we're going to move in the direction of ease. So we have three structures stacked here in the front of the neck. So this is just a mini anatomy lesson. We have a bone called the hyoid bone, which is way up here underneath the chin. And then we have thyroid cartilage in the middle. And then down underneath the thyroid cartilage, we have what's called cricoid cartilage. In between these three structures are ligaments holding them together. So if he has more tension on the left, the ligaments on the left are going to be tighter, okay? So the first thing we're going to do is we're going to have him release the hyoid bone, which is this bone all the way at the top underneath the chin, by moving it in the direction of ease. So if it moves easier to the left, we're going to have him come to the right, move that bone over to the right, and just hold it. Now don't lean your head too far back. Try and keep it kind of neutral. Good. We're just going to hold that. It's a small movement. It's not a large movement. We're going to hold it for about 20 to 45 seconds. Always move in the direction of ease, which means if your tension is more on the right, and most people's tension is more on the right. The reason that Nick, of course, has more tension on the left is that he's left-handed. So you get a lot of your tension on your dominant side. So for most people, this will be more tension on the right. Go ahead and let that go. And just come back in and just kind of move it back and forth again. Did that change anything? Mm-hmm. Okay, so now you've got more even movement back and forth. Okay, so the next thing we're going to do is we're going to release the ligament between the hyoid bone and the thyroid cartilage. So that ligament sits about right here. So I want you to come on to either side of it like this with your fingers. Right? So you're on one side, Nick. Just be on the left. Nope, left side, yep. And widen your fingers like this. And you're going to squeeze it together. Now this looks like a very small, simple movement. This can actually be really, really powerful. That ligament is only about this long. So you don't need a lot of pressure. You're just going to squeeze the hyoid and the thyroid cartilage together. And you may feel like you're slipping a little because you're on the skin. That's not totally true. You will get the structures to move. Okay, you're going to hold that again for about 20 to 45 seconds. Release that. And let's do one more before we check our movement again. We're going to come down, we're going to release the ligament between the thyroid cartilage and the cricoid cartilage, okay? So here's the thyroid cartilage, and right underneath it is this other piece of cartilage. Again, you want your fingers wide, and you're just going to bring those together. And you're just going to hold that. Now, you can do this on both sides. Let's say you have equal tension on both sides. You can absolutely release the ligaments on the left and the right. For demonstration purposes, we're only doing one side and we're doing the tighter side. But you may have equal tension and really want to release the ligaments on both sides. Again, we've held that for about 20 to 45 seconds. We're going to let that go. Let's go back in and let's check our movement again. How's that moving?
It's much looser.
Much looser, much freer. Okay, so the next thing we're going to do is we're going to release the two biggest muscles, well, let's not say biggest, main muscles in the front of the neck, okay? These are deep muscles that sit along the front of the vertebrae. And these two muscles become very important to us. The second one in particular, because it attaches to the base of the head, which means if it's tighter on one side than the other, it pulls the head off to that side. That can actually create this pain that you have in the back. All right, so we're going to start with a muscle called longus colli. Now, longus colli is not the muscle that's attaching to the head. It runs the entire length of the front of the vertebrae here in the front of the neck. So what you're going to do is you're going to take your hand, come up to the top of your head, and we're going to work your left side again, okay? So you're going to come to the top of your head so that you're directly across from the front of your neck, okay? I want you to bring your chin toward your chest with your hand and then lean to the left just a little bit and hold it. This is what we call a passive contraction. So it's actually shortening longus colli, bringing the insertion and the origin together, contracting it, but in a passive sense. Even though he's sitting up and he's holding his head up, his hand is going to take most of that pressure. He's going to get a passive contraction of that muscle. We're going to hold that for our 20 to 45 seconds. Let's let that go. Now we're going to do the second muscle, the muscle that attaches to the base of the head and can really pull the head out to one side or the other. That muscle is called longus colli. And it runs from about midway down the vertebrae up to the head, and it does some rotation. So once again, we're going to put the hand on top of the head. We're going to do the left side for Nick, okay? And we're going to create compression, move that chin toward the chest just a little bit. This time, though, we're going to rotate the chin toward that left shoulder, toward the same side shoulder, just a little bit, and hold that. We're holding for our 20 to 45 seconds. That rotation is going to target longus capitis. It's going to target the muscle so that we really open up that particular muscle, allowing the head to move freely on the neck. Imagine if those muscles, which we have one on each side, both attached to the bottom of the head, if one's tighter than the other, it's going to pull the head off in that direction, causing pressure between the head and the neck in the back. All right, go ahead and release that. Now let's go back in and let's just check one more time. How's our movement?
Much looser.
Much better. Now I'm going to have Nick do the right side for these two muscles as well. Just because, again, like I said, you can do both sides with the ligaments, but you really want to do both sides with the musculature. Okay, so let's take your other hand. We'll put it on top of the head. We're going to create a little bit of downward compression, moving the chin toward the chest and slightly off to the right, and we're just going to hold it. We have 20 to 45 seconds of holding that. That 20 to 45 seconds, it allows the nervous system to register that something is changing, that you're doing something differently. That's not only going to open up the muscle, but it's really going to let the nervous system keep that muscle open so that you don't have to, well, I would say so you don't have to do this over and over again, but the truth is most of us are going to go back to our electronics and have our head in this position, and you will have to do this over and over again. All right, let that go. And let's do our last one. Again, we're going to come to the top of the head. We're going to bring that chin toward the chest just a little bit, and then we're going to bring the chin over toward that right shoulder just slightly. So we're getting a little bit of rotation. We're going to hold that. This is our last move in this sequence. When we're done holding this, we're going to just relax over a towel so that we can actually move the neck in the opposite direction. All right, let's let that go. Check our movement one more time. Not too bad?
Yeah.
Okay, so we've got our towel here. This is a towel that I've just folded in half and rolled into like a little tube. Okay, we're going to put this under the back of the neck, and the desired result is that you're going to put your neck into the opposite position from where you normally have it. Normally have it facing down like this. The curve of our neck actually comes forward. So we really want to let the natural curvature take over. And now that we've released everything in the front of the neck, we're going to put this towel down. We're going to have Nick lay down on the table and put the towel directly under his neck, like so. And just relax the head back off of the end of the towel. You can stay in this position for 5 minutes, 10 minutes, as long as you would like to. This is a great position for the neck because, again, you're really enhancing the natural curve of the cervical vertebrae, of the cervical spine. So this really helps open up the ligaments, and all of those muscles really get kind of a nice relaxing stretch. That's our sequence for the day. Feel free to stay here as long as you'd like to.